Hi everybody, I'm Kim Bergen-Jackson, COO of Health Services at Oak Knoll. You'll notice you got a memo on Wednesday in your mailbox, hopefully, and you understand we're going through some changes. I'm taping today on the 26th of June, which sounds crazy to me that we're almost in July, for your viewing pleasure tomorrow on the 27th. So as I said, you should have gotten a note in your mailboxes today about some organizational changes. I'm really excited to have another new title. We should have skipped the interim step, but I really am managing operations for health services, and Retha Haas is going to be our COO of independent living. And so yay for Retha, a promotion and a title change for me. If you have any questions, you can reach out to either one of us. We're going to be buddy-buddy, and that will free Steve up to do some long-range strategic planning and deal with all of these things coming our way, right? The house on Benton Street, the potential at the ACT campus, their property. You know, I saw it and it's beautiful and I want it. I hope we can figure out a way to get it and have a full campus on the east side. That would be great. So I think it's a really good move strategically. I think Steve is really good at the sort of overarching vision for the organization and driver of our mission and our culture. And so this change will help him and also give Retha an opportunity to step out of her comfort zone and be in an executive position. So all positive things in the management department, you might say. I'm also happy to say that we don't have any cases that I know of COVID. You know, as we get further and further away from the pandemic, fewer and fewer people are telling me if they're ill, which is fine. I have been in your business for 4 years, and I just don't want it to spread unnecessarily at Oak Knoll. So if you are experiencing symptoms and you think it might be COVID or something else, or even if it's just a bad cold, you know, we know how to prevent spreading that. So just take care of yourself and think about your neighbors. I wore a mask when I came back from Mexico. That was my personal preference. Masking is not required, but it is certainly welcome if that makes you feel more comfortable. I just wanted to make sure I didn't bring COVID home, Mexican COVID. I didn't want to share any sort of new variant or anything. It's only June, so I don't have any information about the fall influenza clinic, but I imagine that it will be a fall influenza / COVID / pneumonia clinic. I think that we're headed in that direction, and that they'll change the COVID vaccines, I think, annually based on the prevalence of whatever the current variant is. So getting into a little more normal pattern there. So as I said, I don't know of anybody with COVID among our residents or our staff right now. I still encourage you to keep up to date on your vaccines and do all your protective measures to stay healthy. 4th of July is coming. There'll be fireworks. The Jazz Fest is downtown. I think we have started our summer concert series here and at East, which is amazing. I do think it's been too hot to be outside, so we will take that into consideration. I know you don't need my advice on hot weather, but it's really humid and it's really hot. And so if you're going to walk outside, fine, but you know, make sure you're hydrated. Don't get overheated. Take care of yourselves. Don't walk 8 miles, maybe just walk 4. I don't have any updates on the house project right now. You'll see the lot is flat. It's been filled in. I expect to see some movement over there in July, I think, getting started on the building, and that project timeline is aggressive to be open at the end of March. I would say that we could set our sights on the 1st of July, and then we would be surprised and delighted if we opened early. So that is taking up a bit of time right now. And the health center, as you know, is still full. So we are making accommodations and making it work. And I have, you know, a ton of gratitude to the staff who are working to manage the IL overflow is what we're calling it. So cheers to our nurses and our social work team and anybody else. Cam Atwater, for sure, has been very helpful in managing sort of staffing outside of the health center. So thanks to everyone involved, and appreciate your patience, and know that it's very front of mind for us. And we're working to increase the size of our health center, expand the health center across the street, and hopefully build an assisted living at the East Campus. Maybe we'll know more soon, I hope. See you later. Enjoy your week, and I'll see you in 2 weeks. Take care.